ايش بالبرزنتيشن؟ لك 10 دقائق، تفضل.
تمام دكتور. موضوعي هو عبارة عن awareness about autism spectrum disorder among a sample of pharmacy students بالعراق. كدefinition
عرف نفسك وعرف المشرف، تفضل.
حسن رائد فالح، طالب مرحلة خامسة كلية الصيدلة جامعة بغداد. المشرفة الدكتورة زينب أحمد، قسم السريري. عنوان البحث awareness about autism spectrum disorder between a sample of pharmacy students in Iraq. As a definition for autism, it is a group of neurodevelopmental conditions that causes a persistent social interaction difficulties and social communication difficulties of an autistic patient, and difficulties in nonverbal communication, with the creating of behavior that is a restricted and repetitive behavior with the different severity of the symptoms from mild, moderate, or severe between patients. ASD's autism spectrum disorder starts in childhood and tend to persist through adolescence and adulthood, sometimes causing co-occurring conditions like anxiety, causing depression, epilepsy, or even attention deficit hyperactivity disorder. As in case for causes and risk factors, there is bulk of researches have been done about the causes of autism, and they found there is a strong factor of genetic and environmental factors that increase the risk of developing autism. For example, of a genetic factor or chromosomal condition is Fragile X syndrome and the tuberous sclerosis. Of these cases and conditions increase the risk of developing autism. In case of Fragile X syndrome, البيشنت يصير عنده intellectual difficulties تكون genetically يعني، والاي كيو measurement يكون بالميل 55 where in the female it could be completely disabled, and this can develop autism afterwards. And in case of tuberous sclerosis, it is a rare condition that causes a mutation in the TSC1 or the TSC2 genes, and these two genes are responsible for cell growth and development. So the patient may experience a benign growth in their brains, in their hearts, kidneys, and lungs, which can affect the neurodevelopment factors and developing autism. In case of parents, studies have found that older parents birthing a child have a greater risk of developing autism for that child. Also, autism can be occurring during, before or during or immediately after birth. In case of environmental factors, they are underrated because environmental factors, according to the studies, are everywhere. Air pollution, we found them in the car gases, in the smoke of the cigarettes, pesticides used in agricultural fields for preserving grains, fruit, vegetables, as well as heavy metals found in water, in drinking water. These all found to increase the risk of developing autism in young children. And they gave an example of the families that live near the high road or the free road, and families that live in agricultural fields. There was an increased reports of autism-like traits from the parents. As in diagnosis, the American Psychiatric Association suggested the DSM-5 diagnostic tool, which is a diagnostic and statistical, which stands for Diagnostic and Statistical Manual of Mental Diseases. It has two criteria, each criteria with different points that can evaluate the patient correctly and accurately and diagnose him with a mental disease. The first criteria is the persistent social communication and interaction, and this involves a deficit in socio-emotional communication of doing a back and forth conversation, for example, to a failure of expressing interest and feelings. Also, a deficit in nonverbal communicating or understanding the gestures or the clue or the cues that the other person is saying nonverbally, and also a deficit in understanding and maintaining relationships and difficulties in making friends. The second criteria, which has 4 points, it's a restricted repetitive pattern of behavior that consists of 4 points, as I said. 2 points of them must be observed in the patient to accurately diagnose him with a mental disease. The first point is the stereotyped behavior, repetitive behavior. The second point is insistence and sameness, which can be explained by the difficulty in changing a certain activity and adding something to their routine. The third point is highly restricted and intense fixated interest and activities, and it's somewhat similar to the second point, but they explained it here. The fixation and the abnormal focusing on a certain activity and routine that they do daily. For example, they gave an example of the person that takes the same route every day to get to a restaurant that he eats every day. And the fourth point is the hypo or hyperactivity or reactivity toward a sensory impulse, whether it's a light, whether it's a sound, touch, or even smell. It reacts to it, but abnormally, as a normal person would react to. In case of management, currently there is no cure for ASDs, but there are several interventions that have been used to reduce the symptoms, to improve their cognitive ability, to let them participate even further in their community and society. One of these interventions is the behavioral intervention that is used in improving their social interaction, trying to improve their communication more, and reducing their restricted repetitive behavior. Also, there is occupational and speech therapy, and this therapy could be a parent-mediated therapy that, with the aid of the parents, they could schedule his sleeping pattern, his eating, his daily life would be managed by them. Also, there are medications in older children, and these medications are, according to the studies, these medications work best with the addition or in combination with the behavioral therapy or behavioral intervention. These two drugs are FDA approved, risperidone and aripiprazole. These are atypical antipsychotics. In case of risperidone, it acts on the serotonin 2A receptors more than the D2 receptors, and act to inhibit the dopaminergic neurotransmission in the mesolimbic pathway. And in case of aripiprazole, it's a atypical antipsychotic as well, but it's a partial agonist. As for the study objectives, it was a cross-sectional descriptive online study that directed to the sample of a fifth stage pharmacy students in Iraq. The aim of the study was to evaluate the knowledge, the awareness, and the opinion, knowing the opinion of the students toward autism spectrum disorder, about its signs and symptoms, causes, management, and in general, their attitude toward the autism. Subject and method, time of the study, as well as I said, cross-sectional descriptive study. Sample size was originally 204 participants, but the valid ones were only 181 due to the exclusion criteria. Inclusion criteria, it must be he or she must be a fifth stage pharmacy student, resident in Iraq. The exclusion criteria is any other stage other than the fifth stage. Graduated pharmacists are invalid in this study, and Iraqi pharmacy students, but outside Iraq. Data collection, there was a questionnaire used of 14 total statements and questions. 6 statements using the Likert scale of reactivity from the strongly disagreeing to strongly agreeing. 4 yes or no questions, 2 open-ended questions, 1 true or false question, and 1 statement with a always to never reaction. A statistical analysis using Microsoft Excel, and it was a measure of frequency and percentage. As for the results, the gender difference is huge. Actually, in case of male, there is 47 participants and 134 participants of female. The age was 46 of the participants were 23 years old, and 35% were 22 years old. And these are some of the statements and questions, not all of them, but in my opinion are important to talk about. The first one is the term ASD is the synonymous to the ADHD, which is a false statement. Although 42% strongly disagreed and disagreed to this statement, but 43% of the participants agreed with this statement, with this false statement. Nearly a child with ASD usually have difficulties in social interaction with others, and this is true with 93% of the participants agreeing to it, whether strongly agreeing or just agreeing. It's difficult for an ASD child to adapt easily to the changes in their routine, to the abrupt changes, and 84.5% agree to it. And this false statement that said biologic test, between brackets blood test, could be used as a diagnostic tool, and 57% false the statement. ASD is still considered a stigma in your society. 62.4% agreed with this statement. Lectures should be included in your study, in your college study. 93% agreed, even if it's a small lectures, just to increase their knowledge. The question of ASD person could be cured completely. 47% said no. And these are the two open-ended questions of the most behavioral they had seen in autistic patients, and the most dominant risk factor. In case of behavioral, they said hyperactivity, isolation, anxiety, violence, no attention, lack of eye contact, strict repetitive behavior, difficult communicating. All of these symptoms and signs are documented in reports and studies. And the most dominant risk factor for autism, the major one that have been used, is the genetic and environment factor with 45%. And they also said drugs, pregnancy, isolation, poor parenting, and social network. In conclusion, the majority of the fifth stage pharmacists of this sample had a somewhat good knowledge about the general information about autism spectrum disorder. Most of the participants are female due to the larger number of pharmacy students of the female gender more than the male gender. Limitations of this study, there were 4 limitations. The sample size was limited. The limited number of questions and statements used for the sake of the time-wise يعني بالنسبة للparticipants. Unwillingness of some students to cooperate, and lack of enough researches that conducted inside Iraq concerning this topic. As a recommendation, the knowledge, awareness, and general information about autism, in my opinion, need to be improved in these students to help in the future. They might encounter some child with autism, or a woman complaining about her child with symptoms, weird symptoms, and if the pharmacists have good knowledge and awareness about the autism spectrum disorder, he could direct them to the right healthcare providers. Thank you.